Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsor, Aultman Health System. Today, Brad and I are broadcasting from our administrative offices, and special guests are Sherry Greenwell from Aultman Health Care in your home and Tracy Hawking, Director, Hospice and Palliative Care. Good morning and welcome to the show, ladies.
Good morning, and thank you for this opportunity. We're glad to be here.
Yeah, good morning. Thanks for having us on.
Good. Thank you.
All right. Well, we want to remind our listeners today that our program is also available on our podcast. It can be downloaded from the App Store in your favorite podcast app. Just look for Health Matters with the Medicine Center Pharmacy, and we'd love for you to subscribe to our program. November is National Care at Home Month, and Sherry and Tracy are here to discuss home health care and palliative services.
So, Sherry, please tell us about yourself and your career with Aultman.
Well, thank you. I'm a registered nurse, and I have been working in one capacity or another in the home health field since the 1980s. I have been working as the Director of Clinical Operations here at Aultman for the last 8 years.
And Tracy, please tell us about yourself and your career with Aultman.
Thank you. So I started my career at Aultman in 1996 when the first cancer center opened. It was on the main floor in the east wing of the hospital. We just had a couple of chemo chairs and pretty small. So I'm an old oncology nurse, and it's just amazing to witness the growth of the cancer program and to be part of it over the last 3 decades. But an opportunity was presented late last year, and that I could join the hospice and palliative care program. And I'm so happy to be part of this wonderful team of compassionate people. Being fairly new, I hope I'm able to convey all the great work they do every day on this interview today.
Okay.
All right. Well, November is Home Care and Hospice Month, also known as National Care at Home Month. Why do you think it's important for people to know, or why do you think it's important for people to know about home health care and hospice?
Well, I'll start with that. I think that home health care, such as that we provide here at Aultman, is a really important part of the healthcare continuum that sometimes people don't think about. It can play a huge role in bridging the gap between complete independence at home and maybe a stay, an inpatient stay of some kind, whether it be an acute inpatient stay or maybe a skilled nursing facility or rehab stay. So there's so much that we can offer to people to allow them to remain independent in their homes and take care of their conditions as independently as possible. So I just think it's a wonderful opportunity this month to draw some attention to this type of care.
I agree, Sherry. For us in hospice, it's just so important, just understanding what hospice truly is. Can change how people approach those final stages of life for us. So just really focusing on comfort, supporting the whole family, reducing that fear of the unknown through ongoing education. So it's an important month to make awareness.
Can you talk a little bit about what home health care is for listeners that maybe have never had the opportunity to experience it with a loved one?
Sure. I guess I'd like to draw the distinction that there is home health care and then there is more of the just home care or basic care that's provided in the home. What we do here at Aultman is skilled care ordered by a medical professional, whether it's a physician and a nurse practitioner, or physician's assistant. So it's a medically based type of care. We can provide skilled nursing by registered or licensed practical nurses. We have physical, occupational, and speech therapies available, as well as services that can be provided by a home health aide for some personal care while that skilled care is occurring. And we also have access to social services to help people understand what's available to them and help them manage their arrangements for care at home.
I can only imagine the complexities, and every person's situation is probably different. Is there, you listed a lot of things there. Is there anything else Aultman Healthcare in your home offers that you didn't list there?
I don't think there's anything I really didn't list. I think I would just highlight that it's an interdisciplinary type of care. It is coordinated with the ordering providers, whether that's your physician, nurse practitioner, et cetera. And we work to coordinate all those services for the best possible outcome for the patient. And certainly the patient and the caregivers, whether that be family or other informal caregivers, are part of that care team.
Wow. I know that home care is just really, really super. And I know Aultman really does a good job with it. Where does Aultman Healthcare and Home provide services in our region?
Okay. Well, our physical location, our office is here in Stark County on Woodlawn Avenue. Probably 80% or so of the patients that we serve in home health are located in Stark County, but we can go to all or parts of a total of 9 counties. So the surrounding counties adjacent to Stark here, we are able to go there as well.
Gosh, that's a wide, that's a wide
Yeah,
range.
it is. We can go as far as 50 miles out. We're not always doing that, but yes, we are able to do that. But again, the vast majority of folks are here in Stark County.
So, what is hospice and palliative care?
So palliative care, let's start with that. Definitely a specialized care focused on providing relief of symptoms such as pain or stress from a serious illness. So, and the care can be provided at any stage of the disease. We have a great team of advanced practice nurses and physicians on this team, nurses and social workers. The goal is to improve the quality of life for both patients and their families. Patients can still be seeking active, curative, and life-prolonging treatment while on palliative care. In contrast, the hospice team, is again, it's a specialized care for patients living with a life-threatening or terminal illness, when the focus shifts from curing the disease to providing comfort and dignity and quality of life. It's about helping the patients live fully on their terms with the time they have left. But with both programs, we not only care for the patients, but we surround the family and support also.
So, what is the real difference between palliative care and hospice?
Sure. So palliative care supports people living with disease at any stage. In contrast, what I said previously, the hospice then, hospice is sort of a form of palliative care, and it's provided when treatments are no longer effective or desired. Patients that are tired of going to the hospital, and they really want to focus on being comfortable, having good quality of life, spending that time with their family. And the typical life expectancy is 6 months or less when you're on the hospice program, but certainly palliative care, that can be across the spectrum.
Interesting.
And just to close the loop, how does palliative care and hospice care differ from home care?
Well, home health care can provide services that are similar to palliative care. We can help folks with their pain control and managing symptoms. But the big difference, in my opinion, is the expertise of the palliative and hospice teams. That is what they specialize in, that's what they do. And I think folks really benefit from taking advantage of that specialized care.
Yes, I agree. I think in simple terms, home care helps patients recover and regain functionality through their services. We're with palliative care and hospice, we're just adding support. Symptom management is the big key there, helping with pain and stress and other symptoms that come with, debilitating illness.
So, how about qualifications? How does a person qualify for really any of the home health services we're discussing today?
Well, specifically for home health, as I mentioned earlier, there needs to be an order. So that would come from the patient's provider. They need to be considered homebound in most cases, which means they doesn't mean they can never leave the home, but that normally it's difficult for them to leave the home, and that often when they leave it is for healthcare purposes. The care that they require needs to be considered skilled. And so that's a determination that can be made between the nurse or therapist who sees the patient and the referring provider. But skilled care is the type of care that has to be provided by a nurse or a therapist in order for it to be safe and effective. So it's usually patients who have had an acute illness or things are changing in their condition and they need the services of a nurse or a therapist to help them out with managing that.
Um, pa- Palliative care can be given in a nursing home, correct?
Correct. Yeah,
Okay.
we
All right.
support, and that's considered their home, where they're, where this is about care in the home. And when they're in a skilled nursing facility or extended care facility, that's their home. So we can go into those facilities and assist and support.
My sister passed away about a year ago, and she was in a nursing home, and Aultman Palliative Care did uh, come forward, and was really very useful, very, very valuable.
Oh, that's good to
Uh,
hear.
so very, very.
Thanks for
So
sharing that, Paul.
we we would not have been able to manage her in her home because if she was a second story apartment and all that kind of stuff, so.
Yep.
So the nursing home really was, as well as Altman Palliative care, really was good.
Thank you.
So where are we at on a break, Brad?
It's time.
Okie doke. Ladies, our first break is here. You're listening to Health Matters with the Medicine Center Pharmacy. Okay. All right. Welcome back to Health Matters with the Medicine Center Pharmacy. Are you ready for vaccine season? Stop in or schedule your pneumonia, Tdap, or shingles vaccine online at medicineshop.com. So, how often do people with home health services receive visits from healthcare providers? What happens in these visits?
Oh, well, it's very individualized for the patient, based on the patient's needs and the provider's orders. Most people are seen somewhere between 1 and 3 times a week, to start with. Um, some patients may be seen more often, particularly initially in their course of care as the care plan is getting established and their needs are more acute. Over time, it may decrease. We have some patients that are maybe only seen once a month. And as far as what goes on during those visits, during a nursing visit, there's always an assessment of the patient's condition. There is a lot of education and helping people understand how to manage their care at home and what's important that they would need to report to the nurse or their medical provider. In the therapy visits, there are, a demonstration of the things that they're teaching and the exercise programs that they're establishing. So it just depends on the type of visit, but it's always focused on that patient's care needs and their plan of care.
How about payment? How are home health care services paid for?
Good question, and always something people are thinking about. Traditional Medicare and Medicare Advantage plans generally pay for home health care services without any copays. Medicaid does as well. The commercial insurances that folks have through their employers, that type of coverage may vary by the plan.
Okay.
All right, so let's talk about hospice. There's some myths, in my opinion, about hospice that all care stops. Can you talk to our listeners about why that is a myth and what the true intention is to provide care for in hospice for patients in need?
Sure, absolutely. So I think the people think of hospice, they think everything stops, all care stops, but that is not the truth. Certainly, aggressive treatments are going to stop, but hospice actually provides more care, not less care, in the home or the extended care facility. We come in, the patients receive expert, pain and symptom management. They get emotional and spiritual support. They have 24/7 an hour, 24/7 access to a nurse. So they're going to be doing visits several times a week, and aides going to be coming out several times a week. Social workers will be visiting. Chaplains, the whole group, a very dedicated team, and there's someone always available for the patients. We have a pretty vast team. We have 4 board certified physicians and advanced practice nurses, pharmacists, RNs, aides, social workers, chaplains, and then we also have a pretty strong volunteer team. And they'll come into the home and sit and read to the patient, do whatever they can, whatever needs that patient has, the patient is surrounded in support. And then families always receiving ongoing education. We provide respite care when things get overwhelming, and they can, when you're not a medical person and dealing with taking care of a loved one at home, it can get overwhelming. So we have lots of support and respite help for that. But instead of withdrawing care, I guess the message is hospice brings an entire team to surround that patient and family with compassionate support. So we just want more people to take advantage of it. I think we don't want people to be scared of the H word. Hospice, so.
And it can be scary. I mean, I see when patients come into the pharmacy and they say that, my loved one's going to be on hospice. I mean, it's a lot.
A lot.
It's definitely a lot to take. So,
Yeah.
So how is hospice paid for?
Great question. Hospice is covered by Medicare. So even if you're on a managed Medicare plan like Prime Time or something, when you sign up for hospice, you go back on to traditional Medicare. Medicare pays for everything. I've just never seen a hospice benefit as great as Medicare has provided for our patients. Everything is covered 100%. There's no out of pockets. This is a benefit that patients have paid into their whole careers. We pay for Medicare through our pay, when we're working. And we want patients to take advantage of that benefit that they have. And then certainly we tap into Medicaid also. They pay 100% of the benefits under hospice. And also if you're a veteran, the VA covers hospice fully. But say you're under 60, not 65 years old, and not on Medicare yet, but we do work with the commercial insurances. They have great coverage. We also have lots of charity care that we help patients who are having trouble with if they have commercial insurance that's not covering all of it. So cost should never be a worry for our patients.
Gosh.
Well, that's encouraging.
Yeah.
And I don't mean to paint the scary picture. And I guess, could you just talk about why people shouldn't be afraid of the word hospice in general?
Yeah, it's many people delay hospice because they only associate it with imminent dying, just in those last days. But hospice is really about living well in the final stage of our life. We know death is part of life, but when families call us sooner, patients often experience less pain, more comfort, more meaningful time together with their family. on our services because we can help them sooner. Hospice helps family make the most of every day, that fear we talked about, decreasing that fear and confusion around end of life. We provide a lot of education, hand-holding support. So,
Gosh. What makes Aultman Hospice unique?
oh, we're the best. How I toot our horn. So we're proud. Our program, has 4 board certified hospice and palliative care physicians. They are phenomenal. They help cover care in the home, care in the ECFs, care if patients end up in the hospital, they can come see them there. We have doctors embedded into the cancer programs at Aultman because we know that, cancer is the emperor of all maladies, and those patients need a lot of support. And so we have physicians and APPs that surround them and support. They work so close with the whole team. I can't express, coming from cancer to hospice, how collaborative this team is. Everybody working together, the nurses, social workers, pharmacists, chaplains, they all create a specialized plan of care for each patient and family. Their leadership and compassion set the standard for excellence in our program. I can't say enough good things about them. Our program too, we are blessed to have the Compassionate Care Center. It's an inpatient hospice facility. We're right here on the Aultman Woodlawn campus. It was designed for hospice patients who need short-term respite care. Maybe they want to be at home as much as possible, but maybe their caregivers are getting a little bit overwhelmed or need a break, or maybe have a trip that they want to see. We can take care of that patient for them in the center. And then we also provide in the center intensive support at the end of life. It's really, we are the only hospice in Stark County that has an inpatient unit for hospice care, and we're just so grateful, eternally grateful to the Aultman Women's Board. They built this center for our community, and their annual financial support of our program is phenomenal.
Okay. It is the bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. Okay, you're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. This morning, we are talking with Sherry Greenwell and Tracy Hawking. So, what does it mean that Aultman Hospice has 4 out of 5-star rating with Medicare?
Oh, I love this because we have a very high rating for our program. Quality of care is so important to us. Medicare star ratings are based on family satisfaction surveys. So these scores are all coming from the care, reflecting the care we gave in the home and how the families rate us. And a 4-star rating means families have consistently reported that our team provided high quality care, very clear communications, respect, and compassion at the end. It reflects the trust our community places in us and the dedication of our staff to excellence and care. If you are looking at programs and you have a loved one that may be considering a hospice program, there's a lot out in our community. We are the only not-for-profit program in Stark County. We're proud of that. I encourage patients to go to the Medicare.gov website. You can pull up a Medicare Compare for hospice programs, for really any programs in our area, and look at and compare those scores. Aultman's program certainly outpaces the national benchmarks for quality, and we're very proud of that. So.
Okay. What special programs does Aultman Hospice offer?
So we talked about the special program with the inpatient unit. I just wanted to add real quick how beautiful our rooms are in the Compassionate Care Center. Private rooms, There's only 12 beds in the center, so it's very home-like. If every patient has a private patio that overlooks beautiful green space. The birds, the squirrels, the deer come up into the patios, and the patients get to see that. They really enjoy that. The setting is very peaceful and home-like, and our nurses provide around-the-clock care for that. In addition to our beautiful CCC, our Compassionate Care Center, our program helps fulfill last wishes for patients and families, sort of like the Make-A-Wish they do for pediatrics. We have a last wishes program. So this is supported again by the Aultman's Women's Board at Aultman. They give us the funds to grants to help patients, whether it's a special family gathering or a final trip they want to take, or any moments of joy they'd like to have, but financially can't do it. We'd like to provide that. We want to provide, those last memories and experiences to help families find peace and closure when they experience the loss.
I know from hearing and listening to many patients that your facility, where you care for a lot of individuals post-surgery and all that sort of, that it is very, very special. And everybody wants to go there. And I know after surgery or whatever sort of an event they're into. And you need to make that place bigger.
Yeah. Yeah. We certainly have room at the rehab part of Aultman Woodlawn, for those post-op patients and the recovery and help, such a strong rehab and physical therapy team that help patients get back home where they want to be. But we've been able to take care of our community with the Compassionate Care Center. The 12 beds are enough. We really rarely turn anybody away, so we're able to.
Are there any nursing homes that you won't go into? Did you select certain ones?
Yeah, no, we go everywhere. Aultman Hospice Services and palliative care can go in. We have a 35-mile radius that we follow from Aultman Woodlawn. So we have contracts with almost every ECF in this area, surrounding area.
Okay.
All right, so let's talk about bereavement services and what does Aultman Hospice offer to loved ones after a loss?
Yeah, I believe we probably have the most comprehensive program in our area. Our support of our families continue long after a loved one has passed. We have personalized one-to-one bereavement counseling and support to help family members process a grief at their own pace, as well as a variety of support groups for different types of loss. For example, our chaplains run a men's group. They meet once a month, great camaraderie, and they support each other. There's a lunch bunch, a group of family members that meet and go to lunch and talk about their grief and how they're working through it. We have a great program called Grief 101. It's a weekly sessions for 6 weeks, and we offer it 4 times a year. It's right here at Aultman Woodlawn in the Compassionate Care Center, in our Grief Center. And it's facilitated by a bereavement RN, and it's been very popular. We also have grief groups that meet out at our Aultman Alliance facility. So during the holidays, though, I want to highlight that, grief can be especially heavy during the holidays. Your first Christmas without your loved one, when the first birthday and stuff like that, those are sentinel moments that are really tough. But we host special community events. We have a holiday group workshop, and we have a Blue Christmas service. We're just bringing people together, offering comfort, reflection, connection with other people grieving, and just helping anyone navigating loss during this holiday seasons. And all of our bereavement services are available to hospice families and to anyone in the community who has experienced a loss. We open our doors to everyone, which is unique.
Yeah.
Well, I think that's good because I mean, I don't know. It seems like there's so many things. It seems like your service encompasses so many services beyond just physically caring for the patient at hand, because it sounds like you do an awful lot about helping the family also.
Yep.
Is there anything you'd like to comment on, trying to take care of the family unit that is supporting the person that might be in the transition through palliative or hospice care?
So I think just our collaboration with our group, providing access to nurses and aides and the social workers who jump in and help families. How do I pay for this? How do I need a hospital bed. We need oxygen. We need equipment in the home. We have a team that just takes over and helps these families get everything they need to care for that patient when they come onto our program. The chaplains everybody tries to make it out when they initially sign up for the program, establish, and then have reoccurring visits after that to support the families and patients.
Okay. So how can someone learn more or make a referral to hospice?
So it can come through their patient's primary care physician or any specialist that they see. Certainly, we see things from oncology and the oncologists, but anyone can call us. You don't need a referral from a doctor, but sometimes that's where they come from. Patients and families, they can call us. Our phone number is 330-479-2378. You will talk with a hospice nurse. They can come out to the home and do an informational visit, see if the patient qualifies right now, provide lots of education, discuss eligibility, and just help families understand their options when they're confronted with end of life issues.
Okay. Well, why don't we take our last break and then we can round out with some other contact information and some personal stories of fulfillment.
Okay. You're listening to Health Matters with the Medicine Center Pharmacy. Our break is here. Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thank you. Thanks for joining us. Let's get back to the last segment of the show.
All right. So before the break, we were talking about hospice and how you can make a referral to hospice. How can someone learn more about your home health services too?
Well, you can reach out to us here at the agency. Our phone number is 330-479-4805. And you can, as Tracy had mentioned about the hospice services, you can call and just ask about what we might be able to help you with, or a loved one, what we could help them with. And if in talking it over, it seems like home health is a good option for you, then our intake department can go ahead and contact your physician or nurse practitioner, physician assistant, and see if they would approve a visit for us to come out and evaluate your needs and determine how we can help you and if you qualify for services.
Do most services that you offer, like your home health service, a lot of times, does that probably come after a hospital stay or an event, a health event? Or is it common for patient or a caregiver to call and say, look, I'm trying to take care of my mother or father. I'm at my wit's end. I need help. Can you help me? I mean, I guess I'm just thinking of a couple scenarios because there's one I'm familiar with a patient now at our pharmacy who is trying really hard to meet the needs and the wants of her parent, but it's taken a toll. So could you maybe talk a little bit about that and why sometimes it's hard to make decisions? I feel sometimes it's hard to make a decision because you're worried about the backlash, but at the same time, you're trying to keep the safety of that person in mind and probably your own too. But
Mhm. Well, I think that you are correct that often our services are requested when somebody's been hospitalized or been in a skilled nursing facility because it was obvious there was a change in condition, there were new treatments, and there was a need. We also get referrals from physician offices when they become aware through an office visit or contact with the family that maybe things aren't going smoothly. There's a need for some additional help and support, or maybe they just need to get a better assessment of what is going on and what the needs might be. So usually there is some change that triggers someone reaching out to us, but I would encourage family members or patients, potential patients themselves, please feel free to reach out. We can talk it over with you, and maybe we can direct you to some services that we're aware of in the community that might be helpful to you if home health care isn't the right fit right now. And maybe in speaking, we would determine that reaching out to hospice or palliative care might be a helpful route for you to go. So the people that you would speak with when you call into our office are very knowledgeable, and they can get some information and try to really help you, whether it's something we can do directly or by reaching out to others. And I would just encourage anyone with a question to please reach out, and we'll do our very best to help you.
Is home care still doing um, antibiotic therapy in the home, IV, TPN, all kind of things like that?
Yes, we do. Home antibiotic therapy is fairly common, I think. Fewer people require TPN, which is that total parenteral nutrition, but some do. And yes, we're able to help with all of those therapies. Generally, our help um, consists of getting people comfortable when this gets started. The vast majority of our patients and families are able to learn how to do that very safely and effectively, with us always available to help with any questions or troubleshooting what goes on, and then helping with whatever lab work or dressing changes need to occur, and to coordinate with the ordering providers. But yes, that is some of what we do in the home. So um, just so people can appreciate that it's pretty complex what we're able to help with in the home setting.
What about meals, uh, lunch, dinner, that sort of thing? I understand that one of the companies used to be pretty fluent in all the places they're going to, but I'm not sure that they really exist anymore, but there are some other people I noticed behind us here at the office, in the apartments behind us. I noticed that a service is coming there regularly for somebody.
Mhm.
Uh, and, and I think it used to only do lunch and dinner, or I don't know what we're doing these days.
Yeah, I'm not an expert in that, but I can tell you that there are home delivered meal services called mobile meals and other company names available. There are various types of packages that people can get or qualify for. Um, our social workers would probably be a very good resource for helping people navigate into those kinds of services and how to access those. But those
Mhm.
do exist, and that's an additional support that really benefits some folks at home.
And there's so many services around now that will take patients uh, to the hospital or doctor's office or whatever. Is that part of who home care and uh, work with, or
We we would work with those services. We don't directly provide that, nor do would example, we wouldn't provide the meals, but there are lots of other services out there. And again, some of those are
Mhm.
private ride services. Some of the insurance plans actually have a transportation benefit. And again, those are the kinds of services that if someone was working with home health, our social services folks are very knowledgeable in that. It can help navigate through what's available in the community, either to privately pay for or what might be
Mhm.
available through your specific insurance plan to help coordinate those
Mhm.
services with you.
Okay, interesting. Okay, Brad.
All right, ladies. Well, I think it'd be helpful if, to wrap up, if you have any feel-good story you'd like to tell about how, I always know there's reasons that every day we get up and go to the pharmacy to be a pharmacist. And I'm sure you have at least one that you could share that is how hospice or home care has helped a patient and a family in need. Do you have, either one of you have one you'd like to share?
Yeah, I do. We patient surveys are come in from the families, and so I've pulled a couple out just to see if I could share something with you. This one kind of wraps up all that we do. A family member wrote, "I had never had to deal with hospice before, so I wasn't sure what to expect.
Hmm.
My expectations were not very high. Boy, was I wrong. I had no idea the caring, the help, the comfort that they would provide, not just to my husband, but to the entire family. The nurses, the aides, the music therapist, all who I am and many others that I am forgetting. I am so eternally grateful. I am even in grief counseling now, something I never thought I would do. Your team is amazing, and honestly, I don't know how I would have managed this well without you." So I thought that was a great feel-good story to share.
Wow. Interesting.
Excellent. All right. Well, how about for one additional time, if you could please comment on how listeners can get in contact with you and your team for either home health care or hospice care or palliative care information, and then we'll wrap up.
Well,
Sherry,
I'll go
go for it.
first.
Okay.
So again, for home health care, if anyone has a question, if we can help you in any way or answer any questions that you might have, we can be reached at 330-479-4805. And just in summary, I want to thank you for having us on today. And I am so happy for the opportunity to talk about home health care.
Mhm.
And I'd really like to recognize our staff here at Aultman Healthcare in Your Home and all the home health providers across the country who work every day to provide services to homebound people, because it's really such a vital service and so much appreciated.
We had an early starting with Altman Home Care because we were manufacturing sterile products many, many ways back when Shirley Dungan, who was in charge, I don't know if you knew her. Oh my gosh, she was an Altman nurse for centuries, practically. She really, really was. And she was just a great gal. So I guess that's all we have time for today, Brad, huh?
Yep. Thank you, ladies.
Yeah, thanks, Sherry Greenwell, Tracy Hawking. If you suspect you have a medical issue, please contact your health care provider. Thanks to Altman Health System and our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we will see you again next Friday right here on Newstalk 1480 WHBC. And have a good day.
Thanks.
Thank you.
I know you ladies get a lot of gratitude from helping people and having them have a better day. And it's just wonderful.
Thank you, Paul.
Wonderful.
Thank you.
Okay.
Thank you for making this easy.
Yeah.
The sun might be out today and tomorrow. It's hard to say.
Oh,
Okay.
yeah, I hope so.
Okay.
No.
Have a good day.
Thank
Take care.
You too.
Thank you, ladies. Appreciate
Yep.
you.
Yep.